Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Trouble looms in the health sector as resident doctors consider embarking on an indefinite strike action over unpaid allowances. More high-profile Nigerians receive AstraZeneca vaccines. Yobe Governor, his deputy and other officials in Jigawa join the list. And World Health Organization report concludes coronavirus spread from bat, not food, and most likely from China. We begin with figures over the weekend, which saw low numbers of daily deaths from COVID-19 related ailments in Nigeria, while 2 COVID-19 related deaths were recorded in the previous 24-hour cycle. The Nigeria Center for Disease Control (NCDC) reported additional cases of 7, raising the fatality toll in the country to 2,048. Clarifying the figure, the Public Health Agency says the report from last night includes a backlog of deaths in Lagos State. The NCDC also reported a daily count of 104 new coronavirus infections last night. The new figure, which is slightly higher than the 101 cases recorded 2 days ago, now raises total number of infections in the country to 162,593. The new cases are reported from 12 states. Lagos had the highest figure with 48, followed by Enugu and Kwara, 16 and 8 new cases respectively. Others include Kaduna, which recorded 6 cases, Plateau 5, Kano 5 as well, Rivers 4, the FCT 4, Ogun 4, Edo 2, Ekiti and Katsina states 1 each. The update also shows that 103 persons have been discharged across the country after recovering from COVID-19, increasing the number of those discharged to over 150,000. While testing is still at over 1.7 million, more than 10,000 infections are still active in the country. Globally, the pandemic has killed over 2.7 million people, with total infections reaching more than 127 million cases, according to US-based Johns Hopkins University Resource Center. Medical services in the nation's tertiary hospitals are set to be disrupted as the Nigerian Association of Resident Doctors (NARD) has declared an indefinite strike to commence on April 1, 2021. This resolution was reached by the association at its extraordinary National Executive Council meeting held in Abuja recently. The resident doctors are demanding, among other things, the immediate payment of salaries owed to all health officers before the end of March, the upward review of hazard allowance to 50% of consolidated basic salaries of all health workers, and the payments of salary shortfalls of 2014, 2015 and 2016 to members in federal institutions. Other demands include payment of death in service insurance for all health workers who died due to COVID-19 and other infectious diseases, the immediate implementation of September 2017 Memorandum of Terms of Settlement between the association and the federal government. The association pledged its commitment to the smooth running of all tertiary medical institutions in the country, but has asked the federal government to urgently meet their demands to avert the impending industrial action. And 255 stranded Nigerians in Saudi Arabia have arrived at the Nnamdi Azikiwe International Airport, Abuja. This is via the Saudi Air Flight SV3405 at about 1 p.m. local time today. In a tweet by the chairman of the Nigerian Diaspora Commission, NEDCOM, Honorable Abike Dabiri Erewa, the returnees, as part of a first batch, will proceed on quarantine at the Federal Capital Territory Hajj camp for 14 days, in line with the revised COVID-19 protocols by the Presidential Task Force on COVID-19. Other returnees are also expected in the coming days. Now let's go over to recent data released by the National Primary Healthcare Development Agency. It says that over 500,000 Nigerians have now received their first dose of the Oxford AstraZeneca COVID-19 vaccines. The update shows that eligible Nigerians, 513,626, have been vaccinated in 35 states and the Federal Capital Territory, making up 29.5% percent the target reached so far. However, only Kogi State is yet to receive or commence the vaccination exercise. According to the Executive Director, the National Primary Healthcare Development Agency, Lagos, the epicenter of the disease in Nigeria, has vaccinated over 110,000 people, making it the highest in the country, followed by Ogun State and Kaduna State. The states with the lowest number of vaccinated people are Kebbi, Taraba, Abia, and of course Kogi, that has 0 figures. Meanwhile, in Kaduna State, Sunday marked 1 year since its index case. Subsequently, the governor, Nasir El-Rufai, also disclosed that he had tested positive for the coronavirus a year ago. Latest figures show that the state is reporting over 65,000 people who have now been vaccinated so far out of the 180,000 doses it received. According to the Health Commissioner, Dr. Amina Baloni, Kaduna State has strengthened its health system and since the first case in the state, expanding its testing laboratory from 0 to 5 and isolation centers from 1 to 6 located in Kaduna, Zaria, Kafanchan, Beningwari, while it has also discharged over 8,000 patients. The state launched its vaccination campaign March the 10th, starting with strategic leaders and frontline health workers. Over in Yobe State, Governor Mai Mala Buni, alongside his deputy Aidibade Gubana, who also doubles as the chairman, COVID-19 Prevention and Control Committee in the state, have both taken their first dose of the AstraZeneca vaccine. The vaccine was administered in a low-key ceremony by the governor's personal physician, Dr. Mohammed Umar, assisted by the State Commissioner for Health, Dr. Lawan Ghana. Others vaccinated include the Secretary to the State Government, Alhaji Baba Wali, Commissioner for Humanitarian Affairs, Dr. Garba Iliya, Chief of Staff to the Governor, Alhaji Abdullah Yusuf, and the Governor's personal aides. Marking the official launch of the vaccination, the Yobe State Governor urged the people of the state not to hesitate to take the vaccine, but also to continue to observe the coronavirus safety protocols. Meanwhile, in Jigawa, over 35,000 people are said to have received the first dose of the AstraZeneca COVID-19 vaccine in the state. According to the state governments, they are yet to receive a report of any adverse side effects caused as a result of the vaccine jab. As at today, the state is number 5 with fewer confirmed cases of COVID-19 in Nigeria.
Like other states in Nigeria, Jigawa State was also hit by the COVID-19 pandemic. As of 29th March 2021, 518 cases have been recorded, with 16 fatalities in the state and 17 patients on admission. Vaccination drive against coronavirus disease begins with high-profile individuals in the state who are the first to take the job. Residents in Dutse, the state capital, expressed their opinion on the vaccine.
I'm one of the first set of people vaccinated. This is my cat. This is my cat. Anywhere I go with it.
As for me, I'm going to take it. Seriously, I don't have any second thought about that.
Me that I'm relating with a lot of people, my business sector, different people who come, and it's true hand that I used to work. I must touch the person head, so I don't know whether he have it or he don't. Even though he don't have it, maybe I can even give him, because it's not the only person that I touch. A day I can be able to touch more than 20 heads.
From available records, none of those who received the vaccines have reported any adverse effects, and this appears to be good progress in the view of the state government.
And I want to assure everybody that this is safe as far as we are concerned. We have not had that kind of batch that was actually alleged to have had that kind of side effect where people were complaining outside this country. So those that were supplied to Nigeria are actually safe for as far as we know.
Jigawa State was among the first states to welcome the AstraZeneca vaccine, and a lot of citizens have taken advantage of it by getting vaccinated. For the government, this process has been encouraged as it appears to be one of the most effective ways of flattening the curve against COVID-19.
And over to Akwa Ibom, where the Victim Support Fund, VSF COVID-19 Task Force, has donated 3 solar-powered boreholes worth 54 million naira to 3 secondary schools in the state. The 3 benefiting schools are Methodist Secondary School in Tondang, Obotakara Local Government Area, Comprehensive Secondary School Ikot Okobo in Setubium Local Government Area, and Afaha Inang Secondary School in Ikote Demudo in Ona Local Government Area.
We've reconstructed damaged public infrastructure, public infrastructure damaged by insurgents and terrorists in the northeast. So you would see typically in the northeast, you'd see police stations rebuilt by the Victim Support Fund. You'd see hospitals, you'd see healthcare centers, you'd see schools, a ton of schools built and fully furnished with, furniture. This is the result of, that needs assessment. The 4,000 liter solar-powered borehole facility, in addition to 4 units of automated foot pedal hand washing stations, 2,000 face masks, hand sanitizers in gallons, liquid hand washing soap, and other hygiene and sanitation consumables, which we are now going around the country to donate to 54 secondary schools.
Now, ahead of the 20th National Sports Festival billed to take place in Edo State, athletes in Delta State are gearing up for the Games amid the coronavirus pandemic. At the various camps across the state, particularly in Asaba, the state capital, athletes are seen getting ready for the festival, while the state government says that all participating athletes must take the coronavirus vaccine as one of the conditions to participate in the competition. The state government, however, regrets that international athletes from Delta State may not be a part of the competition this year, as most of them are already occupied with the build-up against the Olympic Games.
The conditions that have been given by the Federal Ministry of Youth and Sports, that every one of them must take a COVID-19 vaccination. So now they are in camp, and then the vaccination is going on. And of course, some of them will break down a little bit, just light fever and slight fever and all that. So that's what is going on now. And then people are still training, and some people are still taking their vaccine. But what we're actually doing is, as soon as you take your vaccine, we allow you to rest a little bit for 2 days. Then after that, you can start up. But the camp is on right now.
Still to come, we have more stories from the international scene and COVID-19. To join us again. Globally, different countries are in different strategies of the vaccination rollout. The United Kingdom appears to be on track with the vaccine, with over 30 million people who have received their first dose. However, stay-at-home COVID restrictions order ends as 2 households or groups of up to 6 people are now able to meet outside. In England, Dr. Sandra Esibo is a general practitioner with special interest in obesity and weight management. She joins us from Nottingham in the UK. Thank you for joining us on the programme.
Thank you for having me.
All right, I want to begin with lockdown that's slowly easing. How do you feel about it, and especially others around you?
I feel ecstatic, I'm grateful, and I'm also hopeful for the future.
But as a practitioner, medical practitioner, aren't you worried still that, the positivity rate is still there, infections are still spreading?
There are still infections, but as we know, the vaccination program is on track, and we've seen significant reduction in number of cases. I mean, it's reduced by 10 times since the peak in January. We've also seen reduction in hospitalizations, and as people being admitted on a daily basis, and also the total number of people in the hospital has reduced. And we've also seen a fall in the number of deaths. I mean, the death rate compared to January is almost 20 times less. So that's just amazing. Like I said, I'm ecstatic. It's good to know that we're making progress. And as you know, the UK is obviously leading compared to Europe in terms of the vaccination.
Indeed. So essentially you would say that the worst is over and the government has managed to avoid a third or even fourth wave.
Yes, I would say that with a lot of positivity. But as we know, the UK government is still urging people to act responsibly. So we're still having to adhere to public health measures and following the guidelines as they've told us to at this point, mixing with just 2 households or in a bubble of 6. I think if people continue to abide by the rules and, there's been a lot of changes to international travels, I think we could possibly, definitely, I want to say, reduce the risk of going into a third wave.
In terms of lockdowns, I want to bring in, lifestyle changes, especially as in your expertise. Do you think that anything will be different? Will people pay more attention to what they eat or things that they do to stay healthy and then stay safe?
Yes, I think we've seen a lot of changes so far. People are a bit more aware and health conscious. So people are being more aware of their risk of developing chronic illnesses, because as we know, people with some chronic illnesses have had the worst outcome with COVID-19. People have had more time to reflect and realize that actually health is very important. As we say in Nigeria, health is wealth. So people realize that it's actually a good thing to invest in their health. And especially people from the Black community, we've seen a lot of people. I mean, there was a survey that was done actually, and they found out that, over 90% of people from the Black community have actually decided to make at least one positive health changes to their lifestyle in the wake of COVID-19. So yes, I think people are a bit more aware, and we know also there's been there's a lot of mental health effects from COVID. And I think psychologically that could have affected, how much people eat as well. So some people might have gained weight in the lockdown. I think on the whole, I would like to say yes, there's a bit more awareness about health issues, and people are willing to make changes with the right support, yes.
In terms of obesity and weight management, how is it that the virus attacks such a person? And then, that is also one of those underlining factors that sort of gives the virus the power to spread.
You're right. I mean, people with obesity have been at an increased risk of hospitalization and also death from COVID-19. There's obviously different factors involved in that. As we know, people with obesity, they had increased risk of having other underlying health conditions like type 2 diabetes, high blood pressure, and even heart disease. And as we know, all of those things as well can increase the risk of having a poorer outcome with COVID-19.
Let's come over to Nigeria. What are your thoughts in our response so far? You know that the vaccinations have arrived, but they're a little too slow with regards to the number that we have compared to our population, and then eventually reaching herd immunity. What's your take?
Firstly, I want to commend the Nigerian public. I think I could see that some people are really working hard, to get everyone vaccinated. I do agree that the number of vaccinations currently in Nigeria is definitely not enough to cover the population. But from what I understand, they're trying to source out more vaccines. I think the government is trying to do that. But I think what I'd want to point out is that, there's been concern about the distribution of the vaccines. I mean, here in the UK, there was a clear, progress that was made, and the Joint Commission for Vaccination and Immunizations, they actually mapped out the vulnerable category of patients, and they got vaccinated first and was slowly walking down that list. And whereas in Nigeria, I think there's been concerns because there's still lots of vulnerable people that haven't been vaccinated yet. But yes, the numbers are low in terms of vaccination, but I still think maybe we need to just have a strategy for giving out the vaccines, and then why the other vaccines come, then I think, there will be more progress in the future in terms of vaccinating the entire population in Nigeria. It is going to take time, but I think the government probably needs to do more. Yeah.
All right, thank you so much. One final question. Have you been vaccinated?
Absolutely. I was one of the first people that got vaccinated. I had my first vaccine in December, and I had my second dose in March. And I'm just grateful to have been vaccinated. And I also want to say, a lot of people have lost their lives with COVID, and my heart goes out to those families that are hurting even in this time. But it's good to know that there's indeed sunshine after the rain.
We appreciate your time. Thank you so much, Dr. Sandra Sibo, General Practitioner. Thank you for joining us on the program.
Thank you.
Meanwhile, as international health experts say, they have concluded that the coronavirus most likely passed to humans from a bat through another animal. A highly anticipated report by the WHO already casts doubt on the theories surrounding the origin of the pandemic, including that the virus leaked from a high society lab in central China or was introduced to Wuhan through the imported frozen food. The specialist team of WHO appointed and Chinese scientists said it would have been an extraordinary situation if COVID-19 was imported from another place because it had not been detected elsewhere at the time. Here's more on our global update.
Thousands flocked to shopping malls, city centers, parks and beaches across Israel as the country relaxed into a Passover much freer of COVID-19 closures than last year. The Jewish holiday, which celebrates freedom from biblical slavery, began on March 27, just 2 days after the health ministry announced that half of the country had received 2 doses of COVID-19 vaccines. German tourists are queuing up to get tested for COVID-19 at Palma de Mallorca airport before going back home after the country introduced a requirement for all airline passengers entering the country to provide a negative coronavirus test result before departure. There have been growing concern over increased travel over the Easter holiday season after airlines added hundreds of flights to the Spanish island of Mallorca, where the infection rate is below the threshold at which tests are required. And Mexico has taken delivery of 1.5 million doses of AstraZeneca's COVID-19 vaccine from the United States, following an accord President Joe Biden made with the country this month. The vaccine were the initial batch in an agreement to send some 2.7 million AstraZeneca doses from the United States to help Mexico offset local shortages for its drive to inoculate its population of 126 million. Meanwhile, England's stay-at-home lockdown order ends today, with people allowed to meet up outside in groups of 6 for the first time in nearly 3 months. Though Prime Minister Boris Johnson is calling for caution due to rising coronavirus cases in Europe. He has also warned that coronavirus variants pose a risk to Britain's vaccine rollout, which is the 4th fastest in the world after Israel, the United Arab Emirates and Chile. Finally, Venezuelan President Nicolas Maduro is proposing paying for vaccines against the coronavirus with oil, though providing little details about how the scheme would work. President Maduro says Venezuela is working to pay for vaccines from the World Health Organization's COVAX mechanism, which provides vaccine access to poor countries, both through Venezuelan funds frozen in overseas accounts due to sanctions and through oil shipments.
Dignidad y recursos tenemos. Dios lo sabe.
Vaccines hold the promise of protecting people from the virus, but the arrival of vaccines does not mean the departure of COVID-19. Let's continue to take responsibility. You can visit our website for more updates, a better understanding of the pandemic. That's channelstv.com. You can find several other stories there at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Wonwoka. Stay healthy.